Welcome to our next video in this series about ACL rehabilitation from surgery all the way back to the field. We're now in post-op week 2 of this progression, and our goals for this week are to get knee motion from 0 to 90, improve quad function, get good patellar mobility, improve scar mobility, and begin right PREs per protocol. In regards to getting knee motion, we have the patient perform active assisted heel slides using a belt. We have them hold a stretch for 20 seconds, and then we have them return to knee extension and then do a quad set to not only improve quad function but try to improve extension. We have them do patellar mobs as was previously noted, and we also have them start working on their scar through the use of scar massage.
Alright, so main thing is your scars are running this way. Okay, so as they heal up, you're going to take your finger, put some pressure on it, and go perpendicular to the scar. And it's like a deep pressure, because you got to move the skin and all the stuff that's underneath it. Okay. So it's not like rubbing. Yeah. Okay. And then you go down to the next one, and so you're just kind of staying in the same spot and go back and forth. It'll be a little tender. The more you do it, the less tender it should get. And then you're going to go up, do some little circles. Do some little circles. So you're trying to get all those layers of skin to kind of break apart and not stick to the bone underneath.
When we think about progressing motion activities and adding light strengthening, remember Maddie's still non-weight bearing, which limits us in some capacity. At this point, I'll have them work on passive range of motion on the bike, with the uninvolved leg doing all the work, and the surgical leg just resting on the pedal. You can see from this clip, in this position, the patient can rock back and forth. It's easier to go backwards than forwards, and in the backwards position, you can see Maddie almost gets 90 degrees of flexion. Of course, we do want to limit this motion as allowed by the doctor's protocol. I'll also have her do straight leg raises, making sure that there isn't a quad lag evident. We'll have them do hip abduction and sideline. In this one, we'll also make sure that they keep the quad tight and try to keep the knee in full extension. In sitting, we'll now progress to doing some open chain quad exercise, doing a short arc quad from 90 to 60 degrees. This not only gets the quad working, but simulates the swing phase of gait. For a week 2 summary, Maddie's non-weight bearing with crutches. Her active range of motion is from 3 to 84 degrees. Passively, we're able to get the 90 degrees that we want for flexion. She has improved quad function, good patellar mobility, and she's working on her scar massage at home. Looking forward to week 3, we're going to progress to gait education with weight bearing as tolerated, work on gaining more motion and terminal knee extension, progressing our exercises to develop a good strength base, and continuing to control swelling and inflammation. Thoughts or questions about Maddie's rehab? Please post them on the forum.